Hi, everybody. It's me. It's Dr. Kestler from Lorain County Community College with today's co-video. I'm wearing a mask today. I'm going to be talking about a mask a little bit here, and I'm going to be talking about a few medical things as well that are going on. I'm going to take my mask off here for a second and let my glasses unfog. So today my temperature is 97.2 degrees, and that's 36.2 degrees centigrade. What I want to talk about today is, first of all, I want to talk about something that I just saw today in the New England Journal of Medicine, and that is, this is out of Italy. And they have done some studies with their population, and what they're finding is they think that there is a cardiac component to COVID-19. And the reason, what they're looking at here, what you can see is they've listed the number of cardiac arrests that occurred last year. That's in orange. And the bars that are blue are this year. And so the idea is that perhaps there is some cardiac component of this disease that we hadn't previously thought about, and so that might be something that's going on right now. The other thing I want to talk about today, and so that is something that we're going to be looking at. We're going to learn a lot from all of this. The next thing I want to talk about today is I want to talk about people with inflammatory diseases. And so if I have this is a pre-existing condition. So if you have a pre-existing condition where you have an issue with some sort of an inflammatory process, those folks are taking immunosuppressive or inflammatory suppressive therapies. And there's a whole bunch of them. And they're also getting COVID-19, especially in New York City. So this is a study from New York City, and one of the first ones of its kind. I have been interested in those same drugs as possible treatments for COVID-19 cytokine storm. So we're not quite there yet. This is not the study I was looking for, but this study here is telling us a little bit something different. So these are people who are already on the drugs that we're interested in, the drugs that may be helpful in a cytokine storm. And so what the people have inflammatory diseases of all kinds of flavors, things like psoriasis or psoriatic arthritis or rheumatoid arthritis, ulcerative colitis, Crohn's disease, all of these kinds of diseases that cause you to have inflammatory responses that you don't want. So you are taking a whole bunch of medications to protect you from these effects. And so you might wonder, well, how are those people going to do if they when they get COVID-19? And the answer is they've been looking into it. We're talking about 86 patients who all developed COVID disease. You'll see that some of them are they're mostly female in this particular study. And there were two categories of patients, either ambulatory, who did not require hospitalization, and hospitalized patients. And then later on, some of them became in ICU, which means they're going to be intubated, which is usually what that means. The interesting thing about this whole story here is shown on the next slide here, and that is, if you look at the excuse me, the patients, let's just look at it from outcome here. First of all, the ambulatory patients did pretty well. The hospitalized patients, for the most part, did pretty well. And there was only one death in this entire study. Out of all the patients, there was only one death. So this indicates, does this indicate that those drugs that they were taking was beneficial for their, that I wouldn't take that conclusion. That is too much of a stretch. What I would say, though, is at least the fact that they were taking these immunomodulatory drugs may have was not an additional burden for them. So I think that's going to encourage people to use these kinds of medications more often when we are dealing with patients who have cytokine disorders or having cytokine disease. I want to talk a little bit about masks for the rest of today. Masks, mask, mask. I'm going to be talking about masks a lot. And I have to tell you that we Americans are kind of anti-mask. You hear, but that's not the rest of the world. People in Asian cultures are very, very clearly in favor of masks, and they are very good at masks, using masks. This is a picture my son shot in Chicago back at the end of January, and this was at O'Hare Airport, and you can see people wearing masks in the United States at that time. They were foreign. They were not people who were born here, but they were other people who were coming from another place, and yet they wore the mask. And there was this is not really a study. I just want to point this next part out. This is not a study, but it is very consistent with masks doing a good thing. This is a guy who is following 2 patients, basically contact tracing them. And the 2 patients that he's following in his story here are from South Korea. This is a South Korean story. And the patients one of the patients uses a mask and another doesn't. And he looks at all the people who they came in contact. Well, I think you can guess the patient who was going out in the world who didn't wear the mask had a lot of contacts who became infected with COVID-19. And I think that is maybe the solution to our current situation. We happen to be in a high lockdown situation, and there are other places where there is a low lockdown situation, including places like Singapore, Japan, Hong Kong, Taiwan, and South Korea. All have taken care of these problems pretty well. So you have people who have low amounts of masks and high amounts of masks. And if you want to be on the list of people who used masks because they seem to be in the good category right now. So is that the answer? I don't know, but it's enough for me to actually put that mask on and use that mask and protect myself from others. All right. Last little story I want to talk about is this, and this wearing of masks is, for some of you, might be a burden too hard to imagine. But I want to tell you about the people we're trying to protect, the elderly people, the people who sacrificed during World War II. And there was an effort to protect the country in World War II and protect our soldiers, so much so that our government contracted with Fleming and his colleagues to get antibiotics to treat the troops with. We had a huge amount of commitment, not only in terms of the physics of making a bomb, for instance, of the manufacture, of the sacrifice where people couldn't buy gasoline and all those kinds of things. And even at the medical side, there was this tremendous effort to fight the disease. And I think if we call this a war that we're trying to defeat this virus, we will be in a better place. And I don't think it's too much to ask to put on this mask when I go out in public. And I think it's actually a pretty good thing to be able to do. One of the things I'll just leave you with this last thought is that I'm looking at my screen. I have been talking to my screen for the last few weeks. That's what all I've been doing, is talking to a screen. If you look at my laptop, there are little spots of dried saliva, I guess, is the only thing I can say, coming from my mouth. That's not happening right now when I have my mask on. My mask is protecting my screen of my computer. So my screen is the signal here. So I want to make sure that I'm protecting myself and others by wearing a mask. Because we're constantly spewing things out of our mouth, even when we're talking. There is little droplets that come out, and those droplets could contain the enemy. I'm going to stop right there, and thank you all for tuning in to this the episode of CoVideos. I want to remind you, wear a mask and be good to each other. I want to give a quick shout out to a very good colleague of mine who has a mother who's very ill right now, Lisa Stifuric. Stay strong. We're all thinking about you and hoping that things go well for you and your family. And I'll stop right there and be good to each other. And may you persist like a lentivirus.